Hamstring tightness, an introduction. My problem statement is, why are traditional stretching techniques such as static stretching, PNF stretching, whether that be the hold relax or contract relax method, ballistic stretching, or any other type of techniques that you may use in your clinic, why are these not giving long-lasting results on patients with decreased range of motion or complaints of hamstring tightness? My plan is to use non-injured patients and also patients who are not suffering from delayed onset muscle soreness, as these can already decrease their range of motion. And I also want to use patients that come in with just a general complaint of hamstring tightness. I will be administering the D-Pass. I know that their scores may be low, but they also could be suffering from other issues, and I would like to find that out as well. Measuring their range of motion can be done two ways. You can use a goniometer, which I think that everyone knows how to use, and an inclinometer, which we talked about this summer, and we saw some people use them. I downloaded one on my phone. It's become very handy using it in the clinic. It's easier, and I think that it gets a better feel for what their true range of motion is. So there are two ways to measure hamstring flexibility. That one is the straight leg raise test, which is where the patient lays flat on the plinth and they do an active straight leg raise. I don't think that this gives a true measurement of their range of motion, because the pelvic rotation adds into that and increases their numbers for their range of motion. So I will be using the active knee extension test, which puts the patient at a 90-90 and then has them actively extend their knee while you place the inclinometer on the shaft of their tibia, and then they actively extend their knee. I've been having some issues with this. I think some of the research showed that the clinicians were using a box to place the patient's leg on, so I think that I need to work on getting one of those made instead of having somebody stabilize the femur in that 90-90 position. So, and then my plan after I establish their range of motion is to go into the Mulligan traction straight leg raising test. The research has shown, which I will talk about in my literature review, that this gives longer lasting results for the patients. So I will get into that later on. My questions are, does the Mulligan actually give longer lasting results? And if it does, how much longer? How much longer compared to static stretching or PNF stretching or any other types of stretching? Is it just giving it a couple of hours or a few days? If we can alleviate having patients come in and day out, getting stretched every single day, that would be great. Some of them come in, stretch every day, go out to practice and stretch, and then they stretch after practice. I'm wanting to give them long-lasting results so that they don't have to do this. And then my next question is, what is actually causing the tightness? Is it shorter muscle fibers, or what's actually going on in there? Do they have a low back issue or a cervical spine issue or ankle issues? And this can be determined by the use of the SFMA and using some breakouts, and maybe we can go on from there, do other Mulligan techniques, maybe some PRT, TMR. But my plan is to decrease the amount of time that the patients are spending in the clinic to give them longer lasting results on their proposed hamstring tightness.